Moving on, in India, schools have reopened. Kids are back in classrooms, but they're not vaccinated. The Drug Controller General of India, or the DCGI, is yet to approve Covaxin rollout for children. This is despite its expert committee recommending to do so. Then why has the process been delayed? The body says it is taking additional technical opinion because the prevalence of infections among kids is still low. Now, that can be an excuse not to vaccinate them, but what do global trends tell us? Here's a report.
India's second wave is subsiding. Infections have come down. Hospitalizations are falling. The country is reopening as a signal of normalcy. Schools too have reopened their doors, cautiously allowing kids back in classrooms. In most states, they're functioning with 50% capacity, along with mandatory screening, wider seating arrangements and staggered lunch breaks. It's a calculated risk, but a risk nonetheless. The festive season is underway in India. It invites potential gatherings across the nation. This is a critical phase as the virus can spread again. Yet we now have life-saving vaccines. The DCGI says there's no dearth of them. But they aren't being administered to children. The 2 to 18 age group, to be specific. The clearances to vaccinate them have been given. The rollout is yet to begin. Should the process be fast-tracked? The indications are strong. Across the world, the Delta variant is on a ride, infecting children in the process. In the United States, adolescents and children now account for more than 1/5 of the new cases, 22.5% to be precise. In the United Kingdom, 1 in 14 students in secondary schools have caught the virus. And in Brazil, the virus yielded a troubling trend, an alarming number of deaths in kids and adolescents. Fortunately, all 3 have started immunizing their children. In fact, more than 25 countries are administering doses to those above 12 years of age. Some of them are even vaccinating children below that bracket. Most of these countries have already dealt with or are dealing with the second wave of the virus. What about India? Last week, the Subject Experts Committee, or SEC, a body constituted by the Drug Controller General of India, recommended inoculating children in the 2 to 18 age group. The recommendation came after trials were carried out on 525 children. Usually, the regulator takes a day or 2 to execute such recommendations. But it's been a week, and India's apex drug regulator is yet to approve Covaxin for children. It has attributed the delay to additional technical opinion that is being sought. Why does it need technical opinion when the expert panel has given its nod? VK Paul, the chief of India's COVID task force, says it's because they want the decision to be taken based on scientific rationale, also based on the supply situation of the child-licensed vaccines. So by when will that decision be taken? No timeline has been given. VK Paul has said a pragmatic decision can be taken by balancing the supply and the potential eligibility. COVID infections in children are very mild or asymptomatic, and that is one side of the story. On the other side, once there is enough vaccine available, that can be used in children. The underlying message is that the low prevalence of infections in Indian children is being taken into account before the doses are made available. Does that mean children are not vulnerable? The situation in the US and the UK tell us they're still at risk. So vaccinating them immediately could be key in preventing another devastating surge of infections. Yes, scientific rationale should be taken into account for this. But as should be data, evidence and global trends. Bureau Report, WION, World is One.
WION is now available in your country. Download the app now. Get all the news on the move.